Hello friends, so today we will be talking about popliteal artery with the help of a 3D model. Notes will be provided at the end of this video. Do like. So, popliteal artery begins from femoral artery. Termination anterior and posterior tibial artery. So, as we can see, this is the femoral artery, which is there anteriorly, but it passes behind the femur and goes into the adductor magnus opening, which is the tendinous opening, and goes behind posteriorly to form the popliteal artery. So this is our popliteal artery. Remember one thing, popliteal artery is there posteriorly, branch of femoral artery. And now we will talk about its termination. Termination, it terminates into anterior and posterior tibial artery. It is tibial because it is very closely related to the tibia. This is the tibia, which is the thick bone as compared to the fibula. So, continuation of the femoral artery and terminates into anterior and posterior tibial artery. Now, we will talk about its beginning, course and termination. So, the popliteal artery begins from the femoral artery. In the opening, in the adductor magnus, this is the adductor magnus muscle and this is its tendinous opening. So, femoral artery passes through the opening in adductor magnus muscle and it forms the popliteal artery. This is a popliteal artery and then it runs downwards and laterally. It goes downwards and laterally, and then at the lower border of popliteus muscle, it divides into anterior and posterior tibial artery. So once again, it begins from the femoral artery, goes into the tendinous opening of adductor magnus, forms the popliteal artery, goes downwards and laterally. This is a popliteus muscle, and at the lower border of this popliteus muscle, it gives anterior and posterior tibial artery. So now we will be talking about its relations. Deepest structure, it is in the popliteal fossa. Now we have its anterior or deep relation. As I said, the popliteal artery is there posteriorly, so we have these bones in the anterior part. Okay, so in the case of popliteal artery, we will be considering these bones as their anterior relation. So, seeing anteriorly, we have this is a popliteal artery, this is a popliteal artery, and we have first the popliteal surface of femur and then back of the knee joint and the fascia covering of the popliteus muscle. So first the femur, its popliteal surface, capsule of the knee joint and the popliteus muscle. And superficially we have the tibial nerve. This is the tibial nerve which is there superficially or posteriorly. Now we'll talk about other relations. So, as I said, anteriorly femur, then back of knee joint, and then popliteus muscle. Superficially or posteriorly, we have the tibial nerve, which is over here, and we will be talking about its lateral and medial relations. So now, talking about other relations of the popliteal artery. So laterally, we have in the upper part biceps femoris, lateral condyle of femur. In the lower part, we have plantaris and lateral head of gastrocnemius. So, laterally, we have the upper part of biceps femoris. So, this muscle, this is the biceps femoris, which is said laterally. Laterally means away from your body, medially towards your body. So, laterally, we have the biceps femoris in the upper part and the lateral condyle of femur. In the lower part, we have the plantaris muscle, which is this laterally, and the lateral head of gastrocnemius. This full part, this is the lateral head of gastrocnemius. Again, laterally, we have biceps femoris, plantaris muscle, and the lateral head of gastrocnemius. As I said, popliteal artery is the deepest structure in the popliteal fossa. It is seen very deep to these structures. This is a popliteal artery and is seen deep to these structures. And now we will talk about its medial relations. So medially, we are having in the upper part semimembranosus and medial condyle of femur. This is medially, and this is the semimembranosus. And we also have the medial condyle of femur beneath it. And in the lower part, we are having the tibial nerve, the popliteal vein, and the gastrocnemius, which is the medial head of gastrocnemius. So, laterally, we are having the gastrocnemius. This is the lateral head of the gastrocnemius muscle. And in the lower part, we also have laterally, we also have the tibial nerve and the popliteal vein. So, both the structures are considered to be lateral to it. Popliteal vein and tibial nerve. Now we will talk about its branches: muscular branch, cutaneous branch, and genicular branch. Muscular branches in the upper part supply the adductor magnus and the hamstrings. Remember one thing, hamstrings are there on the posterior part of thigh. In the lower part, it supplies the gastrocnemius, soleus, and plantaris. Cutaneous branch accompanies the small saphenous vein. Now we will talk about its genicular branch, which are 2 superior, 2 inferior, 1 middle. So, 2 superior, 2 inferior, and 1 in the middle. So first, we will talk about the middle genicular artery, which gives its branch to the cruciate ligament and synovial membrane in the knee joint. Okay, so this is the middle genicular artery. So as we can see, it is a very small and thin branch of the popliteal artery which goes inside the knee joint and supplies its cruciate ligament and also its synovial membrane. And then we'll talk about its other branches. So now we have the medial and lateral superior genicular artery. They wind around the femur and pass deep to the hamstring muscles. And then we are having the medial and lateral inferior genicular artery, which wind around the tibia and particularly the tibial condyles. It goes deep to collateral ligaments of the knee. One very important point to know is that all these arteries reach the front of the knee. They reach the front of the knee and form anastomosis around the knee, as we can see over here. This is the anastomosis in front of the knee. So now we'll talk about its clinical part. Clinical part of the popliteal artery. So, blood pressure in the lower limb is recorded from the popliteal artery. In coarctation of the aorta, the popliteal pressure is lower than the brachial pressure. So over here, palpation of the left popliteal artery is being done. Second point, constant pulsations of the popliteal artery against the unyielding tendon of the adductor magnus may cause changes in the vessel wall, leading to narrowing and occlusion of the artery. Sudden occlusion of the artery may cause gangrene up to the knee, but this is usually prevented by the collateral circulation through the profunda femoris artery. Third point, the popliteal artery is fixed to the capsule of the knee joint by a fibrous band present just above the femoral condyles. As I said, the popliteal artery is the deepest structure, so it is also fixed to the capsule of the knee joint by a fibrous band present just above the femoral condyles. This may be a source of continuous traction or stretching on the artery, causing primary thrombosis of the artery in young subjects. When the popliteal artery is affected by atherosclerosis, the lower part of artery usually remains patent where grafts can be tied. The popliteal artery is more prone to aneurysm than many other arteries of the body. Thank you. Do like, share and subscribe this channel for more such videos. Thank you.